Good morning. It's a great pleasure to talk in front of you. આજે હું જેટલું બોલવાનું છે મોટાભાગનું ગુજરાતી અને ઇંગ્લિશનું કોમ્બિનેશનમાં રાખવાનો પ્રયત્ન કરીશ. હવે આજે મારો જે ટોપિક છે ઓસ્ટિયોઆર્થરાઇટિસ એટલે કે ઘસારાનો વા, કે જે ઇટ ઇઝ અ વેરી કોમન ડિઝીઝ નાવડેઝ. આઈ વોન્ટ સે ઇટ્સ અ ડિઝીઝ, ઇટ્સ અ બેઝિકલી ડીજનરેટિવ એટલે કે ઉંમરના કારણે શરીરને પહોંચતો ઘસારો હોય એના વિશેનું છે. હવે સૌથી પહેલાં શું ઓસ્ટિયોઆર્થરાઇટિસ છે એની બેઝિક ઇન્ફોર્મેશન અને પછી એમાં શું થાય છે અથવા શું એની ટ્રીટમેન્ટ કરી શકીએ એ બાબતે થોડું ડિસ્કશન કરીશું. સૌથી પહેલું અને અગત્યની વસ્તુ આપણે એટલું સમજી લઈએ કે કોઈ પણ સાંધો હોય કે જેમાં બે હાડકાં જ્યાં ભેગા થતા હોય, આંગળી અંગૂઠા કે કોઈ પણ જોઈન્ટની મૂવમેન્ટ થાય, તો એકબીજા તરફનો સરફેસ છે એ સ્પેશિયલ કાર્ટિલેજ અથવા તો ગાદીથી ઢંકાયેલા હોય છે. જે અહીંયા આપણે ફોટોમાં જોઈ શકીએ છીએ કે યલો પાર્ટ એ બોન છે અને ગ્રે પાર્ટ એ ગાદી છે, જેના કારણે કોઈ પણ સાંધો સારી રીતે કામ કરી શકતો હોય છે. હવે જેમ જેમ સમય જાય તો એ ગાદી ઘસાતી જાય છે અને જેના કારણે બે હાડકાં એકબીજાની નજીક આવે છે અને જેથી કરીને દર્દીને દુખાવો કે તકલીફ થતી હોય છે. બીજી એક અગત્યની વસ્તુ કે આજથી અમુક વર્ષો પહેલાં આપણે ગાડીમાં વ્હીલ અલાઇનમેન્ટ કે બેલેન્સિંગ વિશે વાત નહોતા કરતા, જે આજે ઘણી કોમન વસ્તુ થઈ ગઈ છે. તો એ જ રીતે આપણા શરીર માટે પણ એ જ વસ્તુ એપ્લિકેબલ થાય છે કે જેમ કે આપણે આ સ્લાઇડમાં જોઈ શકીએ છીએ કે આપણા શરીરમાં આપણે જ્યારે ઊભા રહીએ, ચાલીએ ત્યારે વજન પસાર થવાની એક ચોક્કસ દિશા હોય છે કે જે થાપાના સેન્ટર, ઘૂંટણના સેન્ટર અને એન્કલના સેન્ટરમાંથી પસાર થાય છે. જ્યારે પણ એ એક્સિસ બદલાય છે, એમાં ચેન્જ થાય છે, ત્યારે તકલીફ આવે છે કે એક બાજુની તરફ ઓવરલોડ થાય. ઓકે, સોરી. So I'll continue in the English only. So there is a deviation in the axis, and because of which there is load of one compartment compared to the other one, and that is why there is a degeneration of the cartilage, overload of the cartilage, and ultimately there is loss of cartilage which is there, and because of which the patient has the deformity over a period of time. So basically arthritis is a Greek word for understanding. It is derived from the arthro and itis. So that is, arthro means joint and itis means inflammation. Whenever there is inflammation in the joint, because of which the patient suffers the pain, and that is why it is called arthritis. There are different types of arthritis, and there is another myth that it affects only the knee. No, it affects the whole body from our head to toe. So as knee is among the largest joint in our body and one of the most complex joint in our body, there are significant number of degenerative changes that occur in the knee, and because of which the knee problems are much more common in our country. Compared to the US population, hip arthritis, which is quite common in European and American population, which is quite common in hip also, in our part of the country it is not that common. There are various types of arthritis, but I would say about 90% to 95% of the patients are having osteoarthritis, and which is the most common, and that is more or less age-related issue that patient suffers. Rheumatoid arthritis, which is there, which is found in usually younger group of patients, particularly 20 and 40s. There are different types of arthritis. Whenever there is an accident and there is a fracture near the joint or inside the joint, then whenever there is the cartilage becomes irregular, and because of which that arthritis develops, that is called post-traumatic arthritis. So there are various arthritis, but we'll mainly concentrate on the main most common, that is osteoarthritis. If you can see this slide, what is the normal structure? On the right side, if you can see, this is the normal knee joint where there is a bone and there is the cartilage, and because of which all the patients, or we have the normal knee movements. Whenever there is loss of this layer, and because of that subchondral bone gets exposed to each other, so because of that one surface becomes irregular, so automatically the opposite surface is going to be irregular, and because of which there is unevenness. So whenever we are driving on the road on a smooth way, so to drive a car becomes easy, but whenever the road is uneven, because of which the driving becomes very difficult. The same thing is applicable over here. Whenever this rough surface is there, patient has tremendous amount of pain and difficulty in walking. So this is basically a degeneration which can be due to the accident whenever there is uneven surface of the cartilage. So that is why the arthritis in post-traumatic or young people develops little earlier if the fracture is inside the joint or if it deviates from the normal anatomical axis. So what are the symptoms that patient may come and represent? So usually the patient has pain. That is the first symptom. In orthopedic or our specialty, the only complaint the patient makes is pain, nothing other than that. And because of the pain, there is significant amount of difficulty that arises in the day-to-day activity of the patient. Another most important thing that everyone should keep in mind, that usually there are multiple reasons for the pain. In old age group, we can consider one is the most common is osteoarthritis. Then there can be spine related issues because of the canal stenosis. The patient has significant canal compression, because of which the radiating pain from the back to the lower limbs, it radiates, and along with that there may be tingling or numbness. And as tobacco and other products are very common in our country, because of that there is vascular issue, there is arterial insufficiency that develops. So whenever we are looking at the patient, we should always keep differential diagnosis in our mind, so which sets into the picture. So that is, one is knee, second could be the lumbar canal stenosis, and third could be the vascular cause. So patient represents with the pain, and gradually it starts with the going downstairs, then upstairs, then gradually it starts with the walking. Usually the patient gives the history that one limb is affected more than the other one, and then they definitely that shift that weight to the other limb, and over a period of time both the knees get affected if the treatment is not taken at a particular point of time. So what are the causes of osteoarthritis? So first of all, we must understand that there is no single cause because of which the patient develops arthritis. If we'll see in the female, in case of females after menopause, there are significant amount of hormonal changes occurs, and because of which the osteoarthritis and osteoporosis, these are very common causes in their common occurrence in case of females post menopause. Then whenever the patient having sedentary lifestyle, when there is no great physical activity, with age it can, and as I said previously, female, if we see the cardiac patients, 80% are males average and 20% are females. In this, in our branch, it is absolutely reverse way, like 80% of the patients are females and 20% are males. And wherever there is fracture which changes the axis of the lower limb, there are more chances that patient may have osteoarthritis of the knee. Nowadays, like what we hear, that hip is also being affected post-COVID, that is more common. That may be steroid related or maybe without steroid, AVN or the avascular necrosis of the hip is very common, particularly in young age group of people. Same way, whenever there is an injury over the knee, it is a possibility but not always possible that common, that is avascular necrosis of the medial femoral condyle. So these are the causes, but ultimately exact one thumb rule that this is the reason because of which the patient has arthritis never is there. There are various stages of arthritis. I will not go in detail of that, but ultimately I will explain. When up till the time when there is micro layer of the cartilage in the knee, there is no pain, and there is sudden spike whenever that micro layer also goes away. So because of it, the patient comes with the complaint that atla varshosthi kashud notu, and suddenly it has started. There are on an average x-rays are the more or less sufficient, but in some cases where there is a complex injury or other thing, then MRI is required. There is no great role of blood investigations. This is for understanding that this is the x-ray. If we want to understand, this is the normal x-ray where we can see that there is a cartilage between the two bones. Whenever that cartilage wears off, and because of which these two bones come against each other, and there is a friction, and because of which the patient has pain. On an average, there is a conservative line of management which is suggested for the osteoarthritis, and on an average there is painkiller. But along with that, if we give the collagen peptides in selected group of patient, it gives very good results, particularly in grade 1 and grade 2. But in advanced cases, it may not be helpful. It's a very common practice to have diclofenac or the steroid for the pain relief. But I would not say that is a good idea, because in our books it is never written that steroids to be given for the osteoarthritis, which is very common in some part of our country. So there are various medication, but the most successful among that is the collagen peptide. The only disadvantage, that is a non-veg derivative. So many patients in our state may not be ready to take the medication, but if it is given properly at a proper time, it gives very good relief. Even after 5 years, patient comes and says that was the medication we want to restart because of the significant pain relief they have. Now, whenever there is a failure of conservative line of management over a period of 5 to 10 years, then what are the surgical options which are available to us? Now, most of us know about the total knee replacement because as it is being one of the very common surgeries nowadays. But whenever there is something which has given good results, but there is always a scope of having a little better. So now there is partial knee replacement, microplasty, or we can say unicondylar knee replacement that can be one of the future over a period of time. Till right now it is giving the similar results related to total knee, but it is possibility that in the future it may overtake the total knee replacement. So I would like to give you the basic understanding about the partial knee replacement or the total knee replacement in this. So first of all, we should understand, as patients do come to you and ask that when they should get operated. So it's a very simple rule. Doctor or the relatives are not the people to decide that whether a patient needs a surgery or not. Only patient can decide that whether the surgery is required or not. If patient can give the answer of all these questions, it becomes very easy for the patient to decide. Whenever there is pain is unbearable, she needs painkillers, she cannot walk with support, or she needs always support, or always needs to take the medication, or in simply it interferes with the day-to-day activity, and that is the right time to intervene or go for the surgery. Now, how to select a patient? In partial knee replacement, it is very important to select the patient. Every patient cannot be a candidate for partial knee replacement. If it is possible, patient is overweight, and if it is possible, definitely patient should go for weight reduction along with the physiotherapy. And always to rule out before advising for the surgery that patient has no spine symptoms or the vascular symptoms. And most importantly, that we all must understand, never to enforce the surgery. Patient should be explained, but never to enforce the surgery that you need to get it done, because after that post-op cooperation becomes much less if the patient was given significant amount of enforcement.
So 3 minutes left.
Yes. So this is just to understand, this is the amount of metal that we put in partial knee, and this is total knee. It is about 1/3 the size of the total knee the patient will have in his or her case. So what are everyone will ask, what is the advantage of partial knee? There are significant number of advantages. It is 75% conserves the normal joint. There is no ligaments are cut. All the knee kinematics remains more or less normal. Patient can resume the activities as early as possible, and there is minimal amount of hospitalization compared to the total knee. It is hardly 2 days, and the recovery is much faster. And if process fails, it is very easy to convert from partial knee to total knee. So this is the only a small amount of bone which is removed from the knee, which is, we can say, tibial biscuit. So it's only 3 millimeter. This is the X-ray picture that patient will see, that only 1/3 amount of the joint is replaced and not the total one. So you must remember, it's a technically demanding surgery. So everyone may not advise. It's not a pre-TKR. All over the world, according to the data, there is about 90 to 95% of the people are doing well even after the 15 years of surgery. So this is just to give you an idea that what could be the functional outcome, because total knee has given the very good outcome. But as we can see over here, this lady was operated for both the partial knee replacement. This is the second post-op day, that where she is able to walk very much comfortably. Another patient, I have tried to show all the different patients. This is again before suture removal. Patient can resume most of his activity in his or her home. Another patient, both partial knee and the amount of activity, with ease what he or she can presume or resume, that is very important, and very comfortably they can take all the movements and go to the normal day-to-day activity. Even they can lift the leg very easily. This is another where the patient can go downstairs or down the hill very comfortably. Even this lady was operated after 2.5 months of surgery, both partial knee. Another lady, this is only 4 weeks after surgery. Patient is doing cycling with the great amount of comfort. This is the lady. This lady is a wife of a gynecologist who can play the garba even after the surgery. And one of the most important thing, this patient was operated, and within 60 days he went for a 2,500 kilometer self drive after the surgery independently. So patient can resume more or less all the activities within a short time. Then what are the different advancement that I will just, this is basically right now is a more era for robotic surgery. Now most of the people are asking for it. So we have also come up with the robotic surgery, which this is the only platform which provides partial knee, total knee, and total hip replacement. So there is only one system right now available in the world which gives all the things in one. So we are having that. And same way, the hip also, there is post-COVID, the patients are having significant number of problems. The same can be dealt with the total hip replacement and give a wonderful life. Thank you.